afternoon, and welcome to our Appropriations Human Resources Subcommittee. We thank you all for coming and presenting to us your issues and concerns. At this time, we'll begin our meeting. Will our Speaker Pro Tem speak? And the lights went out. So, thank you, Madam Speaker, and we look forward to hearing from you.
Thank you, Mr. Chair. I had a recommendation. If we can find the available money, I wanted to recommend that we increase the clothing allowance for foster care children by $100 at every level. And I have handouts for you that show at every level what that would mean each year. And we haven't had a significant increase since 2002 when Sonny Perdue came in his first year. It was a minor cost of, 3% increase. I think it was last year. At intake, when a child is brought into foster care, they currently receive $309. And then each year they may receive up to $206 up to age 12 and $309 age 13 and over, which is woefully inadequate, even just to buy shoes at a Walmart for the children that are growing. And it is an issue. I think it's one that we need to address. What the chart shows is the state dollars and the federal dollars. You'll notice that relative foster care is paid for through TANF, but the number that's circled, 460,816, is the amount that it would take to bring all the children up. And not that I'm suggesting that's enough, but I think it would make a difference to the families that are providing care for Georgia's children that are under our care. And what I've learned in looking at this since last summer is that some of these children will have multiple placements in a year, and as they go from placement to placement, they'll lose shoes, underwear, their sweater, they need a backpack, they need, in the nonprofit sector, does what it can, but I feel like we have a state obligation to these children. And so I just wanted to encourage the committee to consider making that investment in Georgia's children. All right? I'm happy to take any questions.
I was going to say, committee, is there any questions?
Thank you. That's all.
Thank you, Madam Chair.
Thank you.
We appreciate your time. I forgot to mention there's a sign-up sheet to your left on the railing here. If you're here and wish to speak and haven't signed in, please do so. And if you have, then we'll call you in due time. Okay. We'll now hear from Governor's Office of Children and Families, Director Katie Jo Ballard. Ballard, if you please come up. Thank you for coming and being with us.
Good afternoon. Thank you for having us here today. So I'm here to discuss the Governor's 15 recommendations. So as you may have seen, there are several changes going on, but I will go by your line item sheet. The Governor's Office for Children and Families is currently organized into 4 divisions. We have the Youth Development Division, which does after-school programming and abstinence education. The Family Violence Division, which gives out grants for domestic violence and sexual assault. Prevention and Family Support, which focuses on child abuse and neglect prevention and home visitation. And then the Juvenile Justice Division that gives out federal dollars for diversions and alternatives to detention. So in line items 26.5.1 is where we are.
Okay.
26.5.1 and 26.5.2 reflect the changes of merit-based pay and employment retirement system. And then where the real changes come in are after that. And I'd like to discuss with you first items 26.5.3 and 26.5.5. So both of these refer to transfers to the Criminal Justice Coordinating Council. The Governor's Office for Children and Families underwent zero-based budgeting analysis over the summer of 2013. And out of that zero-based budgeting analysis came recommendations from the Governor for areas for improvement, consolidation, and better alignment of our state resources. So 26.5.3 refers to the TANF allocation for commercially sexually exploited children, as well as the Division on Family Violence administration dollars. So that's 6 positions for family violence, 1 position for commercially sexually exploited children. 5 positions for family violence, 1 for commercially sexually exploited children, 6 positions overall for the Family Violence Division. So he's recommending that we change the domestic violence grants, sexual assault grants, and commercially sexually exploited children activities over to the Criminal Justice Coordinating Council. And currently they have different federal grants that align with victim services, such as the Violence Against Women Act or the Sexual Assault Services Prevention. So that's where this alignment comes in. Before I move on, do y'all have any questions about the family violence transfer?
No, please.
Thank you. The Governor is also recommending transferring over the Juvenile Justice Division to the Criminal Justice Coordinating Council. The Criminal Justice Coordinating Council currently receives the state dollars for diversion and alternatives to detention, and this is just aligning those federal dollars with the current state dollars as well. So this would be the transfer of the staff as well as the federal dollars to the Criminal Justice Coordinating Council. Is there any questions?
What section was that?
26.5.4.
Okay.
So those 2 divisions are the divisions that he's recommending for the Criminal Justice Coordinating Council.
All right.
And then in 26.5.6 and 26.5.7 is the recommendation of the transfer of the Prevention and Family Support Division to the Department of Human Services. So this is $1.175 million in support of the Children's Advocacy Centers, which is TANF dollars, as well as our federal and state dollars received for child abuse and neglect prevention programs.
Okay.
Are there any questions about the transfer to DHS?
What do you have any? Representative, you have any questions? You want to repeat that, Jim?
Oh, yes.
I'm sorry.
No problem. So 26.5.6 and 26.5.7 is a recommendation of the transfer of the Prevention and Family Support Division at the Governor's Office for Children and Families. So that's child abuse and neglect prevention, home visitation, and support for the Children's Advocacy Centers. It's a combination of federal and state dollars.
All right.
Okay. And then with the recommended changes, the Governor's Office for Children and Families will be able to focus more on its core mission of what it was created for, and that's child policy development, eliminations of duplication, and budget alignments across the state. And currently, with all of the grant administering that the office was doing, we did not have the manpower or the time to focus on those activities. So the Governor really sees a value in aligning all of our child policies across the state. So currently we have the Children's Cabinet with the 14 child-serving agency heads that rests with the Governor's Office for Children and Families, and it's led by the First Lady of our state. And through the Children's Cabinet and the Governor's Office for Children and Families, we would be directing the child policy for the state and aligning budgets. So, for example, if Criminal Justice Coordinating Council and Department of Human Services are both giving grants for family violence victims, it'd be the Governor's Office for Children and Families' job to align to make sure that we're not duplicating services, supplanting, identifying gaps of where children's services may be needed across the state.
Okay. Thank you.
Thank you.
Bud, I know. Representative, you have. I know you were just getting on the end of that. Okay.
Great.
Thank you, Ms. Ballard.
Thank you so much.
This time we'll hear from Commissioner Keith Horton, Department of Human Services. Commissioner, how are you today?
I'm good. How about yourself?
Great. Thank you for being here.
Thank you for having me.
We had the pleasure of having you a couple of weeks ago, didn't we? So,
Where was that at?
when you made your presentations over
Yes.
to our
To the joint. Yes.
joint
Yes.
meeting. So,
I thought it was out in the field somewhere.
no,
I've been trying to get around, trying to see as many people as we can.
thank you. You know, I'm impressed with the movement you're carrying us in. So, thank you for coming.
Thank you. Thank you for that. Let me see if I can move this contraption, this computer, if that's okay. Committee members, again, my name is Keith Horton. I just want to take this time to brief you on the additions and changes that we have for FY15 budget. I also want to take this time to try to link up the money with some of the initiatives that we have. So what you have before you is a presentation. You should have a PowerPoint presentation, and you should have some handouts as well along with that presentation. Now, the presentation that you have has the tracking numbers in them, so that if you want to follow along with the tracking sheet, you can do that as well. But the presentation you have has the tracking numbers in it as well. I think it's so important that we talk about some of the initiatives that we have going on in DHS so that you have a context of how we're spending the money that you're allocating for the department. Now, I'm going to cover, in that presentation that you have, I'm only going to cover the changes to the budget. We have a number of programs within the department, but I'm only going to highlight those changes within the program. So that's the first slide. I'm going over to the second slide, which says fiscal year 2015 highlights of the budget adjustments. So if you look at that second slide, you'll see the current budget of state budget of $456 million, and then you'll see statewide adjustments. I want to make sure that we're on track.
We're on page 2. Page 2, right? Wow.
Okay, yeah. So the statewide adjustments, you'll see that throughout the presentation. I want to go ahead and address the statewide adjustments. We have about $6.3 million in statewide adjustments, and that includes employee retirement, merit-based pay, PeopleSoft billings. So you'll see that throughout, and I wanted to go ahead and get that up front, so as you see the statewide adjustments, you know what those are. And we also will go through the program. As we go through the programs, we'll address the other adjustments that you see on that particular sheet. There's one thing that I would like to bring to your attention, and that is the federal medical assistance percentage adjustment, which is called FMAP. And you'll see that in the presentation. But I want to address it up front so that you understand what we're talking about. This FMAP has been increased percentage-wise, and so meaning that we'll receive more federal dollars. However, you will see a reduction in state dollars. And I just want to reiterate, this is not a cut to a division or to a program. This is only an adjustment. It's a zero-sum game, but it's only an adjustment. But I just want to make sure you're aware of that. Okay, now we move to the first program, which is adoption services on section 27. So if you're looking at the tracking sheet, it's 27.1. So adoption services facilitates the permanent placement of children in a safe and stable homes by providing financial assistance and support. You see the statewide adjustments we have for that, and you also see the first FMAP decrease of $176,000. Again, this is not a cut. Are there any questions about that? Feel free to ask questions as I go along. Madam Chair?
And another committee.
Well, I just want to recap what I told the committee members. There's a PowerPoint presentation that you should have. It is aligned with the tracking sheet. We're only covering in the PowerPoint, it only covers those programs that we've made some changes to. And also within that PowerPoint, you're going to see some slides with some initiatives. And I wanted to put things in context to show you how we're linking up the money that you have allocated for us and how we're spending that money and how we're spending taxpayers' dollars. The other thing that I was mentioning to the committee members was that there's an FMAP change, which is an increase in the federal Medicaid assistance. So you'll see a percentage increase in there, and you may see a decrease in the state appropriated funds. That is not a budget cut. That is just reflection of a zero-sum game. We have increase in federal dollars. They will be offset by a reduction in state dollars. So right now we're on we're on the child care licensing, which is I think the fourth slide in your packet. Child care license, which is section 27.3. Only thing we have, this child care licensing, it resides in our IG section. It resides in the Office of Residential Child Care. And this program does licensing, inspections, monitors, and renders enforcement actions on facilities that provide out-of-home residential child care for those children that are there over a 24-hour period. The only change that we have there are statewide adjustments. I also mentioned that the statewide adjustments, just to bring you up to speed, the statewide adjustments for us includes employee retirement, the merit pay increase, and PeopleSoft billings. So those are the three components of the statewide adjustments. And then other adjustments I will cover as we go through each program. The next one is child support services. Child support services has statewide adjustment of about $600,000. I'm going to talk mainly about the workload adjustment. You see a workload of adjustment about $3.3 million. In child support earns incentive dollars based on performance. And I always try to use this analogy on the incentive dollars. If you would think about the House of Representatives and how the House of Representatives are apportioned across the nation. As a state loses size or people, then another state may gain population, so that state may gain a representative, and a state that loses population may lose a state. Well, the federal government does the same thing for child support in the sense of allocating federal dollars. So based on the performance of a state, will determine how much of that pie, that finite amount of money that is available, would that state receive. Child support has been doing a pretty good job over the last several years and has increased its incentive pay. But during the stimulus period, 2008, 2009 period, child support was allowed to match those federal dollars. 2 to 1, almost 2 to 1. And so through that particular period, OPB, along with the agency, DHS, developed a strategy to maximize that matching ability. And through that particular period, as child support was drawing down more federal dollars, the state said, well, let's do this. Let's reduce the amount of state dollars that the program is receiving. So what this does is, this $3.3 million does, it brings the program back up to operational level from the stimulus period. Any questions about that? Yeah. We no longer can match, and that's another thing my deputy commissioner just informed me, we no longer can match those incentive dollars. So in child support, this really brings them up to a level so that they don't lose caseworkers or child support agents. So on the next slide, I did have an opportunity to talk with you about some of the initiatives that are going on in child support. I'm very excited about the problem-solving court. I'm just going to highlight just a couple of the initiatives that we have going on. The problem-solving court, which is an alternative to incarceration. We have 16 problem-solving courts across the state that are either pending or existing. This is an excellent program that is designed to transform individuals so that non-custodial parents, men and women who owe child support, can actually pay child support. It is a partnership between the Administrative Office of Courts as well as with department, along with the Superior Court judges. And we're very excited about this particular program. Another initiative that we have is the prison paternity program, where we're going in and doing DNA testing on individuals who are incarcerated. And then lastly, we have the reentry program, which is a great program that works with individuals who are incarcerated to help them reintegrate back in the community. Now, this particular initiative aligns with the governor's Criminal Reform Act. All right. The next slide is child welfare services. Now, this one, you see the statewide adjustments, and there are 3 workload adjustments that I'm going to cover. The first one is the $8.7 million, and I think we talked about this very briefly during the joint on the 14th. But this has to do with the fee for Medicaid service. A portion of a caseworker's time is billable to Medicaid under the target case management. Specifically, the time when caseworkers are working with a child on medical or behavioral health, or has to refer a child, or even if they have to go and take a child to the doctor or work with the child on any type of medical or behavioral type issue. A portion of that time is billable back to Medicaid. Once we transition to the CMO approach, which will be a merit group, once we transition to them on 3 March, the Centers for Medicaid will only allow one organization or one entity to charge to that for Medicaid, and that will be a merit group come 3 March. Our caseworkers still have to do the work, and this money that we're asking for, requesting is $8.5 million, goes to offset the work that goes on in defects, even though we won't be able to bill. So this money goes to state money as a request to offset the money that we would normally be able to get through Medicaid. So the amount that we're asking for is equivalent, if we don't receive that amount, is equivalent to about 175 caseworkers, Child Protective Service caseworkers. So it's very important that we get this particular request. The second one that I'm extremely excited about is the $7.3 million, and that's for Governor's very gracious and giving us a 3-year plan, or allocating money for a 3-year plan. This 7.3 is for a 3-year plan of bringing on about 175 caseworkers per year, and this will go a long way in the reduction of our caseloads, as well as having safety for our children that we serve. And then the last one I mentioned at the joint appropriations meeting, the $911,000 is for 16 additional caseworkers. And what this does is really annualize this for Child Protective Services caseworkers intake system. And we're moving to a 24/7 intake system. So this will bring in more workers for our intake system. So that's really what those 3 are for. So I just didn't want to talk about the money. I wanted to really illustrate through a graphical depiction of how we're using the money, as well as our caseload side. So the next slide you have, it says child welfare caseload ratios in Kenny A. So if you look at the graphical depiction, you'll see that you have a purple line there. The purple line represents Kenny A consent decree. And we talked about that Kenny A consent decree. That affects 2 counties, Fulton and DeKalb counties. Even though it is a statewide consent decree, the focus is on those 2 counties. So you see the caseloads have risen somewhat, but they are below 15 for the Kenny A counties. The blue line represents the combined caseload with Kenny A. So you're looking at the state plus Kenny A, which represents the blue. The red represents the 157 counties. So it represents the rest of the state minus the Fulton and DeKalb counties. And the black represents the difference between the Kenny A and the rest of the state. And you can see where we are on the red line for the state. We're up close to 20 cases, and ideally we would like to have at least 15 cases per caseworker. This is why the governor's plan is so important, because it will get the caseload down to a more manageable amount. Any questions on that? I'm going to go to the next slide, which really talks about some of the initiatives. And I want to preface by saying that there was a lot of good work that had been going on in child support. I got asked a question a couple of weeks ago at another hearing about, wow, you got all these initiatives going. But there was some really good work that was going on before I came on board. And I want to point out something that is not on the paper here, but our child death report. That is something that Commissioner Reese, along with the previous director, Ron Scroggie, had developed, along with the governor's office, was a child death report, a quarterly child death report that really illustrates how children are dying in our state that DFACS touches. So you hear that magical number of 152 child deaths that DFACS have touched. Well, that report actually breaks it down into categories of those deaths. It breaks it down into accidents, it breaks it down into homicide, it breaks it down to natural causes, and it breaks it down into undetermined. So you can, any citizen can go to our website and can pull up that report and look at it and see for themselves how children are dying. One of the interesting things about it, and one of the things that really hurts me more than anything, is that if you look at that, we have children that die almost every quarter from co-sleeping. That means that some relative or somebody has put a child, an infant, in the baby, has rolled over the child, or a pillow has rolled over the child, suffocated the child's died. Those are preventable deaths. And we certainly need the public, and that's the reason why it's posted on the website, so that our public, our officials, our stakeholders can go there and see for themselves how children are dying. And we have a number of kids that are dying that we have touched that are medically fragile. And so we're working with different organizations on these medically fragile children. So the slide that I want to address right now really talks about some of the initiatives. So there were some initiatives that were already started before I came on board, but I'm going to talk about some of the ones that we've started so forth. So the first one is review those cases that have been screened out over the last 12 months. And Dr. Hill and her team have done a tremendous job of looking at those cases that were screened out. So if you heard about the incidents that happened in the fall, you heard about the screen outs. And those screen out is simply a caller that has called in and made a referral or report, and our intake caseworker made a determination, made a judgment call not to send anybody out for an investigation. So she and her team are going through all those cases that were deemed screened out over the last year, to go through them and see if we can identify those ones that we should go out. And there have been a number of cases that we have gone out to investigate. The other thing is, in August, Dr. Hill and I sat down, along with some others. We sat down and we started looking at how do we become more consistent and standardized with our intake system. So right now, or previously, you could call a county, and you can call a county, and there might be different policies or different standards on whether or not a person actually goes out and investigates a particular case. So one of the things that we wanted to do was prevent the screen outs, or at least have some consistency and standardization across the state. So we have developed this centralized intake system, 24/7 centralized intake system. We started rolling that out in earnest sometime around September time frame. We rolled out about half of the state. So now phone calls will now come to a centralized point, and we have individuals who will be screening those calls. Will it increase the number of investigations? Absolutely. It's going to increase the number of investigations. But it will also provide consistency and standardization in our welfare system. And then we're working with external stakeholders, and I'm proud to announce that we have CHOA that has stepped up. They have always been working with us, but they want to do even more. We have the Blank Foundation. We have Truett Kathy, who will be working with us as well. And we have a number of faith-based initiatives, a number of faith-based organizations that have stepped up and said we want to help. And so we'll be working with those. We also have very excited about predictive analytics that we have that we're going to be moving towards. And predictive analytics is nothing more than identifying those red flags that could lead to child neglect or abuse. So we have partnered and contracted with the Barton Child and Law and Policy Center for the predictive analytics. And one of the components behind that is working with public health on an MOU that will give us information across the state on child deaths. So in addition to providing information to the public and to stakeholders about child deaths that DFACS has touched, what we don't have is information across the state that we haven't touched. And so we'll be receiving that information, which will help us tremendously on being able to do better predictive analytics. Any questions? All right, I'm going to move on to Child Welfare Services Special Project, which is Section 27.6. And that is the project that Ms. Ballard just mentioned, the move from the governor's Office for Children and Families. It's continued administering the child abuse and neglect prevention and home visiting services. So we just talked about, she just briefed that one. And this transfer is a result of zero-based budgeting. The next one is Department Administration. You see the statewide adjustment. You see the other adjustments increasing for telecoms is $2 million increase for workload adjustment. And this is for our admin budget for, this will go a long way in dealing with our critical IT needs. So we really need this funding to deal with our critical IT needs. And then there's one other one there. There's a $44,000. That $44,000 has to do with transfer of one individual from the Child Fatality Review Board, and I already know there are some plans from the governor's office as well as from, I think, some legislators who want to move this position somewhere elsewhere, and we are fine with that. We'll do whatever the will of the legislature or the governor on this particular position. So if it needs to move, then we'll move it out of our budget.
Can we back up to the telecommunications?
Yes, sir.
The $2 million you said it would assist your IT.
Right.
Is that in the realm of this automated system that you?
This is really replacing one-time funding that we have. Back in 2013, you all, the legislature, allocated some funding for us at $2 million. And then in 2014, we found it internally. This year, we don't have the funding to continue, but it needs to be there for our IT critical functions that we have. So it's not necessarily for the automated system. This is just for our IT functions.
But the automation's still in place as far as the call-in capabilities.
Oh, yes, sir. Yeah, we're still moving forward with that. You're talking about, I think you're talking about, there are a couple of initiatives that we have ongoing. One is the automated call center, not automated call center, but the call center solution that we have for our DFAC side of the house, and I'm going to talk about that shortly.
Okay.
And then we have the child welfare system, the 24/7 child welfare system that we're moving to. We have not rolled that out across the state. We've gotten about halfway with that. And we want to make sure we get it right before we completely roll that one out. All right. Elder abuse and investigations. This one is something that I'm very excited about as well, because this is akin to the Child Protective Services. One of the things that I was really struck in when I first came on board and really talked with Dr. Bulat about the Division of Aging Director was that we have caseworkers who actually go out and they're working with our elderly population. They're trying to prevent abuse and neglect and working with those individuals, elderly population, those elders who've been abused, those seniors who have been abused. And they are akin, in my mind's eye, to our Child Protective Services. So there's been funding allocated for our APS workers, 32. This is a 3-year plan. You can't divide it into 11, 11, 11, but the first year we'll have 11 APS workers, and these guys go out, and these guys and gals go out, and they do great work working with our elderly population that have been exploited or abused or neglected. Their caseload is currently about 1 to 35, and I'm going to show you a chart on the next page, but the national standard is about 1 to 20. And then there's another adjustment on there. There's a temporary emergency respite. This one is a huge one as well. If you recall, there were two centers that were raided by GBI over the fall. There was one down in Thomasville, and I think the other one was up in Conyers somewhere. But you had a home, a facility that was exploiting our elderly population, and so GBI went in and raided those individuals. Well, Dr. Bulat and his team, they actually have to go and find a home or find placements for those individuals. That's a very daunting task when we don't necessarily have the funds. These funds will go a long way in providing shelter, temporary shelter for those individuals who have to be removed from their home and be placed in a safe environment until we can find somewhere permanently to put those elders.
An example of that would be what?
Example would be like a bed. I don't necessarily think we would take them to a nursing home, but it would be some type of a place that was safe and secure for an individual. So we would have to do the contracting. He's going to have to go through the contracting process and find a vendor to ensure that we have some beds across the state so that if we have another event like that, then those elderly people can go somewhere safe, not necessarily a nursing home. It'll be a temporary shelter until we find somewhere permanent to place those individuals.
So would it be one central location for the whole state?
No. The goal is to have, and Dr. Bulat, feel free to chime in. The goal is to have places across the state for individuals. So I know you're in Augusta, so you may have a place in Augusta, you may have a place in Atlanta, you may have a place in up North Georgia, you may have a place in South Georgia. That's something that we're going to have to go through and do some analysis on. But the goal is to have not necessarily a central location, but to have beds throughout the state where if something happens in your district, then that senior doesn't have to go travel far to get to a safe place until we find permanent housing for that individual.
Commissioner, the model we're looking at is trying to identify a statewide vendor who provides provide primarily personal care homes across the state. So if there's emergency relocation or law enforcement needs to have a resource for an elder who they find, that we could work locally with a licensed personal care home primarily to have an emergency bed, and then ATS can come in and help find a more permanent location when we have the time. Oftentimes these happen on a Friday or Saturday or Sunday night, and the resources just aren't available right now. So we have elders wanting to stay at the police precincts in a jail cell because there is no place in the community right now. We don't have elder youth shelters across the state.
Yeah.
So this is kind of a stopgap measure trying to create some type of resource available for adult protective services and law enforcement so they have a place to bring supplies that's safe, secure, and get assessed to make sure that they have services until we come in there to provide long-term support.
This is a
While we're cozy enough in this room, I know that it's difficult for them to pick up anything unless it's on a microphone. So as that goes forward, let's just make sure to try to do that.
So this is a huge step for us as a state, and I think this is a very, very good start. We want to do some analysis, and if there's another need or more need for more homes, then we'll certainly come before you. But this is a great start for the state. The next slide really gives you a graphical depiction of the caseloads for adult protective services. I said this. I always try to link the two, child protective services and adult protective services, because they're just as important. Each one is important to our citizens. And so if you look at the chart, the blue tells you the average new investigations. The red bar tells you the number of wards that we have. Actually, those are individuals who we have in our care, custody, and oversight. They actually belong to the state just as our foster care children do. There's a map that is provided in your handout as well that lists the wards across the state. And what is very interesting about that map is the number of wards that we have concentrated in certain parts of the state. And so these are individuals that the Division of Aging and DHS are responsible for. And then you see the green bar. I'm back to the slide now. You see the green bar, which is our APS workers, APS workers, and you see that's kind of remained stagnant over the last few years. So those 11 positions, that 3-year plan, will be a definite boost for the APS side of the house. And simply because of House Bill 78, we have more situational awareness around exploitation of adults, and that has increased the number of investigations that Dr. Bulat and his team have seen over the last several months. The next one is the Elder Community Living Services 27.1. You see the statewide adjustment. This program is the Elder Community Living Service Program, provides a continuum of support services to seniors, adults with disabilities, and their caregivers to enable them to stay home as long as possible and independent as possible. You see the other adjustment. That's the FMAP, $1.1 million. Here again, there are no cuts. Zero-sum game, so there are no cuts. I just want to reiterate that point. The next one is Elder Support Services. You see the statewide adjustment. The Elder Support Services provide employment to low-income elderly individuals, assist Georgia's Medicare beneficiaries and families to understand their rights, benefits, and services, and that's a statewide adjustment. Next one is Federal Eligibility Benefit Program. This is where, sir, this is where your question comes in about the automated system. So I'm going to address there. This is our food stamp, Medicaid, TANF, the old welfare. If you think of TANF, temporary assistance for needy families, it's an old welfare program, and child care. So those are the eligibility services that we do within the agency. We provide eligibility for those particular programs. There is a statewide adjustment, and there's also $162,000 there for as we move foster kids and adoptive assistants to the CMO approach. We need a dedicated team to help transition those kids from either county benefits or transition them from working with the state over to the CMO, to that CMO approach. So that is what the $162,000 does in state funds, along with the 50% federal match. It creates a unit to ensure that we transition those kids, and so this is an ongoing need to transition kids from the state to AmeriGroup. And they have specific tasks such as moving children to only Medicaid cases within 24 to 48 hours, as well as removing children from active or pending county benefit cases. So that's the need for that. The next slide is really just gives you another graphical depiction of how the increases, how we've seen increases in our federal, if you will, federal entitlement programs. And I don't see them as handouts. I see them, we see them as a hand up. So you can see the increased demand that we've had over the last 6 or 7 years for food stamps, TANF, Medicaid, and child care. Now, I will say this on TANF, or the old welfare, we have one of the lowest TANF numbers in the nation. We have about 35,000 people that are receiving TANF, or old welfare, which is a huge deal in my mind's eye, because we are managing that population. We're ensuring that only the people that really need to be on TANF or receiving TANF benefits, and there are, of course, there are work requirements for that population, for most of that population. We have a very high food stamp population, though, and so that's one of the things we're working on. So the next slide gives you the number of cases that have increased over the last few years as well, and you can see the number of cases for our OFI. So I'm really trying to paint a picture on why we had to do some of the things that we've done over the last few years, if you will, and the last couple months. If you go to that next slide, it talks about eligibility initiatives. The Georgia one, the 3-year process. It says 3-year process. This is where we get into the remodeling of our, I guess you could call it re-engineering of our business model for eligibility services. You saw the slides before really gave you a graphical depiction of how the increased demand has gone up. Well, at the same time, we have seen an decrease in the number of caseworkers that we've had. So there was a 3-year plan that was designed, 3-year plan that was, not a 3-year plan, but a plan was designed a couple years ago to do some business re-engineering on the eligibility side, wherein instead of doing face-to-face, we would be able to serve customers either by phone or online. So we're trying to take advantage of the technology and leverage some of that technology that's out there. And I told you before, I'll be the first one to tell you we have some opportunities for improvement. We definitely have some opportunities for improvement. And so we've taken some multiple steps into moving into a direction so that we can better serve our customers. One of the things that I'm very excited about is having the IVR, which will be up and running by the end of this month, integrated voice recognition system. So when a person calls, just as they call the bank, they can now press 1, or tell them to press 1 if they want to check their benefits. We don't have that system in place right now, which is causing an overload, which is causing part of the problem of an overload on our phone system. So we'll have that in place by the end of the month, where customers can now call in and they can press 1, they can press 2 to find out the benefits, they can find out general information, just as you do at your bank. And if you want to speak to someone about doing an interview, or if you want to speak to someone about specific information about your case that is not addressed on that, then you can talk to a live person. So that is what we're doing on this particular Georgia one. And we have some ways to go, but we're working diligently. We're working with GTA, and we're working with our partners to see how we can move as fast as we can to satisfy our customers' needs. The other thing is the able-bodied program, and that is something that we're going to be rolling out either this month or early next month. And that able-bodied program actually put work requirements on individuals who are receiving food stamps. Right now, there are no work requirements on individuals who are receiving food stamps who have no dependents. So the criteria will be individuals who have no dependents and who are not working will have a work requirement, meaning that they will have to go take GED classes, they will have to go do job hunting, they have to do something, and then we'll have people that will monitor their progress. They'll still receive their benefits, but they will be mandated to go and do those work requirements, whatever the assessment comes up with. So we're going to be piloting that in 13 counties or 13 areas across the state. One of them is in Augusta. And so we're going to pilot that, see how that goes, and then the ultimate goal would be to have work requirements for individuals, for all individuals who are not working, who have children that are over the age of 12. That's the ultimate goal, is to have work requirements for that. So we're trying to be disciplined and do the right thing with taxpayers' dollars. All right, out-of-home care, 27.17. You see the adjustment there of $527,000. Again, this out-of-home care services promotes the permanency of children. This is our foster care. This is our foster care population. So this out-of-home care is our foster care population. You see the budget there for $71 million. Again, this is a zero-sum game. As we receive more federal dollars, and we reduce the amount of state dollars that we receive. So there's no budget cuts there. And believe it or not, that is it. What are your questions?
Let's start with Representative Howard.
Thank you. Thank you, Mr. Harden, for your presentation. Go back to that Georgia 1 3-year process initiative that you're working on.
Yeah.
One of the things that I run into dealing with seniors, I'll use that category. And I've seen it, firsthand. As we move into this automated punch 1 to get this, punch 2 to get that, there's a frustration with seniors, elderly people that are finding it difficult to make that adjustment when they don't get an able-bodied person, a physical voice, on the phone. And I know we as we move into this advanced technology age of doing business, that we have to make the adjustments.
Right.
Is there any room in there to consider that group where they can have some sort of a hotline that they could call without going through all of the
Right.
I mean, I sat in a room with a 92-year-old lady once, and she was telling me how much trouble she was having getting through, and watched her do it. I let her go through the process, tried to help her a little bit, but she just could not
Navigate through that
system.
Right.
Is there anything a way to sort of fill that void?
So to answer your question, I think one of the things that we could look at providing some type of alternative resources for the elderly population. But one of the things that is available is the AAAs. So we have the area aging on agencies. I think I got it right.
Mm-hmm.
The AAAs are out there that person can utilize as well. And I think we have navigators and DAS as well that can help those individuals. I think one of the things that I'm very excited about is the fact that we have a streamlined process. It should be a streamlined process for an application for our elderly population. One of the things that I asked DFACS to do, because they are the ones that, where the money comes through on the food stamp piece, there's some outreach money there. And what I've asked them to do is don't spend money, let's not spend a whole bunch of money on the outreach for our, let me rephrase that. Let's spend outreach money on our elderly population, because what I would like to see is a proliferation of food stamps to our elderly population. So Dr. J and Dr. Hill and their teams are working together on educating, on a process of educating our elderly population on how to get food stamps. But certainly I think we can do more than what we've done. And I'll certainly take your suggestion and see if we can actually implement something like that, whether it be a hotline or whether it be some alternative towards helping that individual. But AAAs are available as well, and they are available to help those individuals. And I know they've been bombarded with have some of the similar problems trying to get through as well. I think once we get, and let me share this, I think once we get to a point, and I think that there is the light at the end of the tunnel. I do see it. There's a light at the end of the tunnel. Once we get to a point where we are able to stabilize our systems, we're able to have technology actually benefit us and work for us, I think then we'll be in a much better position to help that population. But we're not going to stop because of technology issues. We're going to move forward. And I'll get back with you on a plan on how we're going to address that. Right.
Representative Henson.
So if you look at the map, the white, there are no wards. So wards are individuals that we have in our care, custody, and oversight. These are individuals, and I almost put it akin to having foster care, but these are kids. These are adults, seniors that have been turned over to the state, and so we're responsible for that. So the Division of Aging spearheads that particular effort. But the white, there are no. You see, there are no wards there. In the yellow, I think you'll see that there's just based on the number of wards that we have in those locations. The red, if you look at the red, and it's kind of hard to see, but in DeKalb, there are 100 wards in DeKalb. And in Fulton, there are 67? 67. So we have a large number of wards that are in the metro Atlanta area. And then you can see in some of the other areas, you can see the number of wards that we have. So yeah, I was really trying to bring attention to the fact that we have this population out there, and there's a need for adult protective service workers because there's a heightened awareness around exploitation of our elderly population, much higher awareness. I know Dr. J has been bombarded with calls about can you send somebody out to deal with this particular situation now that we have HB 78, which is a good thing. Yes. Yes, they age out at 18. So we have, I'll say about 10% that age out every year. That is Dr. Hill, and she'll chime in if I miss something on that. On our foster care, I mentioned we have about 7,500 kids in our foster care, in our care, custody, and oversight, about 7,500, average about 7,500. We have kids that age out every year, and we encourage them to sign back in. So they actually once they emancipate, they can actually sign back in. One of the issues that we have noticed, and one of the problems that we're addressing is that a kid that is 19 years old that signs back in, he or she does not want to be treated like a 15-year-old or 14-year-old. So we're looking at policies and procedures to ensure that we have some way of not only safeguarding the kid, but ensuring that we allow the child to have some independence in their life at age 19 once they emancipate. So we're working closely. We have a unit that works with the kids. As a matter of fact, we have a conference next month to start working with our foster kids at a very young age, starting at age 10, if I'm not mistaken, at that conference. Is it 10? Age 14. So ages 14, we're going to be meeting with foster kids across the state in Atlanta for a conference to start working with those individuals on identifying where they're going to go to college, if they're going to go to technical school. We're going to have all kind of vendors there, and we're going to be trying to help those individuals mature so they can make wise decisions once they get to a point, if they're not reunited with their family, or if they're not adopted, so they can make wise decisions once they turn 18. We want kids that turn 18 and emancipate to have nowhere to go to sign back in. We want them to sign back in, because you and I know that if we have a kid that is over 18 that is out there and has no clue about life, then they're going to be consumed by the world, and we're going to see kids that are going to be in jail. We do. If they sign back in, yes, we do. Yes. Yes. And they can go up to 26 now. with insurance. Most of it is Medicaid. It's Medicaid, yes. No, we're not doing the Medicaid expansion. Because they have no income, because mainly.
It was already allowed under prior law, but there was a change several years ago.
Okay, all right.
Representative Epps.
One question, Mr. Ford.
Yes, sir.
You know, we've covered a lot here, and
Yes.
and I appreciate the attention you've given to some probably areas that really needed it. But one I haven't, and is transportation. And I say that from probably 80% of my district is rural.
Yeah.
You know, dealing with community service centers, senior centers, personal care home, host homes, and the one issue we have is transporting these elderly. And there seems to be no supportive efforts among the state agencies to address these 13 to 15-year-old vehicles that are not reliable to put these people in. I've had a couple of instances where it's not for a church choir bus coming down the interstate picking up 8 elderly clients that were stranded beside the road. They would have just been left there. And, you know, I've talked with and community service centers that come under your range and your budget. There was absolutely no movement that we could even try to find to get these transportation issues addressed, except for a surplused out corrections van with bars still on them that would not even accommodate those that could not, you know, no wheelchair accessibility. Are we going to try to move in the direction of providing reliable transportation for these people that are at your mercy? I mean, we've had staff members put them in personal cars to get them to doctor's appointments or whatever that they.
Yeah. So to answer your question, as I travel throughout the state, transportation is always an issue, not just for our agency but for other agencies as well. We do have transportation dollars that we administer we have a partnership with behavioral health. As a matter of fact, the money comes through us. We have a contract with them to provide transportation. But most of our transportation is contracted out. If not all of our transportation is contracted out. We certainly can go back and look at the instances that you're talking about in your area to see what we can do. Money is always going to be an issue. It's going to be, and I can almost say with certainty that money is an issue in those particular instances. But here's some of the things that I think that we can do better from a department standpoint and from a state standpoint. We could do a much better job of leveraging some of the resources that we have in our state. And what I mean by that, we have faith-based organizations that we have not been tapping into to leverage those resources, where there's a partnership to help some of our seniors or help any of our citizens. And I think there are some things that we can do at a different level, once we get more funding for transportation. But I can certainly go back and look at the instances that you're talking about and see what we can do.
I mean, has any thought been given to, I know you have a budgetary allocation per client. Have you thought about maybe funding a center and let them through a lease agreement?
Well, you're talking about the senior citizens, the senior centers are funded through the counties.
No, not the community service centers. They're funded through you.
Yeah. You want to, Dr. J, you want to just chime in on that?
Can we get you to come
on
to
up,
the microphone? So there are people all throughout the state watching right now. Want to know.
Yeah. Your agency provides insurance.
Yeah,
services
Consolidated Transportation through DHS does transportation and contracts out throughout the state for transportation, and that happens for DBHDD, for mental health, behavioral health, developmental disabilities. And at the local level, that's generally managed by the regional commissions, the transportation that the senior centers rely upon.
Some of the transportation is done directly by some of the regional commissions. Some of it is subcontracted out to providers, and I know Atlanta works that way a lot. There's I believe the state maybe contracts most of it out directly to a provider and doesn't go through I guess a middleman, so to speak. The area of senior transportation, that's always a big concern of ours. We try to work closely with Consolidated Transportation to ensure that transportation is available. But it's one of those things that because of the structure that we have, we work with Consolidated Transportation as well. So we depend upon the same vehicles as DBHD does. And the way they stagger transportation is one provider, they may do aging trips in the morning, DD, mental health trips in the afternoon, and aging trips in the afternoon to get people home from the centers. But it's something we're working on. We have various voucher programs that we're trying to coordinate across the state to give people more control over their transportation options. Rural areas, it's really important to have alternatives to the consolidated transportation. It just doesn't go where seniors need to go. I mean, more seniors need to go other places than just a senior center. There's hospital visits, there's grocery stores, there's just general shopping that needs to happen, and coordinated transportation doesn't go to those areas. So we're trying to work with our partners to expand options, but it's one of those, and for seniors in particular, it's a concern for ours in our division to expand transportation. I have the same concerns as you do about some of the safety and quality of the vehicles. When we're able to, we work with our AAAs, and our AAAs will get involved with the regional commissions to make sure that the vehicles meet safety standards, but that may not always happen.
Yeah, under the contract, I've seen contracts be 50 to 75 miles from the centers.
Yeah,
that they would come, so you can imagine what kind of day they spend.
We have seniors spending entirely too much time on some vehicles.
Yeah.
It is
Commissioner also mentioned funding as an issue. This is one of the places where sequestration at the federal level has hurt us, because when those cuts, those are some of the funds we have used for transportation, so that does impact us as well.
You know, I know the senior centers have the ability for the rural transit, and then the personal care and the host homes provide their own under there. But these community centers that fall under yours are just kind of left in a gap that none of the others say they're eligible to support or to help out, and they have just been virtually without staff cars, unable to move them.
I think that's something that we need to. That's something that we need to talk with you. If we could talk with you offline about.
Sure. Thank you.
And get that information.
Thank you. I wanted to make sure, and you may have said this before I was able to be here, but the number of children in foster care right now, approximately, do we know?
About 7,500. About 7,800. About 7,800 kids in foster care.
And is that sort of average? Does it stay about that range?
Right.
Okay. Just need to know that. Are there any other questions from the committee? If not, thank you so much, and thank you for the work y'all are doing. Appreciate it. And next up, we have Director Schmeig, or the Vocational Rehab Agency, whoever may be speaking.
Madam Chair, members of the committee, good afternoon. Thank you very much.
Good afternoon to you, too. It's good to see you.
Good to see you. Pleasure to be here before you this afternoon. And my presentation is really only a title page and 2 sheets, so mine's going to be pretty quick. And then certainly I'll entertain any questions you all may have. My name is Greg Schmeig, and I'm the Executive Director of the Georgia Vocational Rehabilitation Agency. We've been in existence since July 1, 2012. Do y'all have a copy of the handout we should have given you? Okay, good. If you just flip past the title page to page number 2, what I've outlined there for you in hopefully pretty simplistic graph is each of the programs under the agency, the 14 budget, the proposed changes for 15, and the reasoning for each of those proposed changes. And so I'm just going to walk through these for you. A lot of these are pretty much standard. So you see in the first one there, which is actually the Business Enterprise Program, the acronym BEP, a proposed change of basically $4,500. That's the increase in the employer share of ERS. $1,600 is part of that merit-based pay adjustments. And I'm going to defer some comments about the pay increases until I finish going through the numbers, if that's okay. Departmental administration, same thing. $82,000 increase in employer share of ERS, $28,000 increase for merit-based pay adjustments. The third one down is the Disability Adjudication Services. DAS is the acronym, and that's 100% federally funded through Social Security Administration, so there's no state funds associated with that in any way. Obviously, no changes. Fourth one down is GIB, and that stands for Georgia Industries for the Blind. And likewise, they receive no state funds, and so there's no proposed changes there. And then we get down into the one I'd like to spend a little more time talking about. And in the 14 budget, there was a line item that just said Roosevelt Warm Springs Institute for Rehabilitation. In the proposed 15 budget, that line item is actually going to be split. And part of that talks about the transference of the medical operation at Warm Springs to Georgia Regents University. So what you're looking at there in that next row down where it says RWS, Roosevelt Warm Springs Medical, that's really just referring to the hospitals at Warm Springs. And so what you see there is the 14 appropriation for Warm Springs in total was the 5.1. They're showing an increase of $469,000 to cover projected operating expenses in the hospitals at Warm Springs, but they're also showing a transfer out of the hospitals of $3.5 million. And what you see right below that is the proposal to actually move the vocational side of Roosevelt Warm Springs under the VR program as a sub-program. So the 3.5 that you're seeing, or the 3.5 million that you're seeing in brackets in the medical, is basically moving that $3.5 million away from the medical operation and into the vocational operation of Warm Springs, which would then become a sub-program of the vocational services. Let me just spend a minute just explaining this partnership with Georgia Regents University again, just to make sure that you're clear on this. As you may recall, last year, one of our big budget situations was the deficit in the hospitals at Warm Springs. And the best solution to that was recommended that we felt would be the best long-term solution was a partnership with Georgia Regents University and Health System. This past July 1st, we entered into an agreement with GRU. They have assigned an administrator this year down to the hospitals. And our plan is to move forward with that transition so that as of this coming July 1, 2014, in essence, those two hospitals, the rehab hospital and long-term acute care hospital at Warm Springs, will be, in essence, outsourced out to Georgia Regents University and Health System. The way I would look at it is they will own the P&L, the profit and loss statement for the hospitals come this July 1. All the expenses incurred by the hospital, they will be responsible for. Likewise, all the revenue earned by the hospital, they will be entitled to. The advantage of doing that is it brings in the expertise of Georgia Regents University, which I think is the 5th oldest medical school in the country, and their expertise to really make those hospitals at Warm Springs flourish over time. It also allows the other half of the Roosevelt Warm Springs campus, which is very good at vocational service, to really streamline their focus purely on vocational services. So we're very excited about this move, and this is the shifting of the dollars to actually accomplish that. There are two additional benefits I'd like to point out by making Roosevelt Warm Springs Vocational Services a sub-program of the state VR program. Those two benefits, number one, as I mentioned, it allows it to really focus on vocational services. But number two, and almost more importantly, as you all know, within the state system, you're allowed to move money within a program. You can't move money between programs. So it gives us the flexibility to try to maximize the use of our state funds in the VR program to maximize our federal vocational rehab grant, which we have not matched for, I think, the past 4, 5, or 6 years. So it really gives us some opportunities that we wouldn't have if the vocational part of Warm Springs stayed separate from the VR program. So if you total all that up, the total proposed changes for 15 in state funds is really that it nets out to the 1.3 million. Now, before I ask you to flip the page, is there any specific questions I might be able to answer about that? Yes, ma'am. Stands for Disability Adjudication Services. In most states, they actually use the acronym DDS, Disability Determination Services, but that's already claimed by driver services in our state. And what DAS does, Representative, is they are the behind-the-scenes folks that actually process applications for supplemental Social Security claims and disability claims paid through Social Security. We have about a total of 500 employees. We have 5 locations across the state. Most of the employees are adjudicators, and they are basically reviewing medical files, psychological files, trying to determine, is this person entitled to Social Security supplemental income. The actual payments are done by the Social Security Administration. And so their budget is 100% federally funded through Social Security Administration. Sure? Let me ask you to flip to the next page then, which is the last page of my handout. So there, what I've done for you is basically shown you the proposed 15 budget with all the sources of funds. So same lineup of programs: the Business Enterprise Program, Departmental Administration, Disability Adjudication Services, Georgia Industries for the Blind. And now in 15, the new line item, which will be Roosevelt Warm Springs Medical Hospitals, and then the VR program, which will include the vocational services at Warm Springs. So you see the state funds, the proposed changes, the additional federal funds, other funds, and just for your information, other funds, for example, in the row where it's Georgia Industries for the Blind, that's dollars that they actually earn from producing the contracts, either at Bainbridge or Griffin and Albany. For the hospitals at Warm Springs, the other funds, the $18.5 million, that actually represents earnings that they will achieve, hopefully, through billing private insurance companies, Medicare, Medicaid on hospital patients, etc. And then the VR program, the majority of the federal funds is the VR federal grant. Let me talk just a little bit about the VR program, since that's our largest program, and that's probably the program most people have the most questions about. When we started a year and a half ago, the VR program, as it transitioned to us, was spending at a rate of about $90 million a year. However, the budget that we inherited for that didn't cover that. So this past year, we have spent all of our attention on making adjustments in the VR program to live within the budget. In fact, the budget is about $70 million, so it's about a $20 million effort at adjustments. And we have done things primarily like hold on vacancies of our professional staff, consolidated offices where it seemed to make sense, reduce operating expenses. We've made program policy changes that we think will impact things. And I'm happy to say that the VR program is currently living within its budget. The good news of that is we've been able to, because of those efforts, reopen priority categories, all the priority categories actually, as of this past Saturday, February the 1st. But what that doesn't speak to is the potential of what the VR program could be. We would like to serve a lot more Georgians with disabilities. Our mission, pure and simple, is to put people with disabilities to work so they can live independently. Obviously, we have a large federal grant that for years we have not been able to match. So for us to be able to, for example, double the number of people that we serve in VR, which we think we could do, in particular with the help of our great provider community, we would need additional resources. Should we ever get those additional resources, the goal would be to invest those in expanding services to serve more people, put more people in jobs. And so that's really the long-term goal. Is there any questions I might be able to answer about the VR program? Yes, sir. I thought you had a question, Representative. Then let me shift real quickly to a comment about pay raises for staff. And I'm going to use an example, and I'm sure that other state agencies feel the same way I do. The example I'm going to share with you is our certified rehab counselor. That's our highest credentialed professional staff person in our state VR program. The acronym is CRC, Certified Rehabilitation Counselor. To become a CRC, you must have earned a master's degree, and you must have passed successfully a national certification exam. The average wage of our CRC is about $34,000. Because of that, we have about a 30% vacancy rate in that position. They can make more money working elsewhere. They have not had raises in the past 6 to 7 years. Most of our direct line staff have not had raises. And so the CRC is an example of really the people who do what we're supposed to be doing by law, and that is serve individuals with disabilities. So I just wanted to express my appreciation and thanks to the General Assembly, certainly to the House and the Governor's Office, for this recommendation to at least do something in terms of merit increases. And then in closing, I'd like to share a story with you. You know, we are a bureaucracy, we're an agency, but that's really not who we are. We are the people that we serve. That's why we exist. And so I'd like to share a story with you about an individual who was served through our VR program, because they really represent the face of all of us who serve people with disability in our state. And if you bear with me, I'd like to read it so I don't miss any aspects of it. During high school, John Hall participated in wrestling and cheerleading until a catastrophic spinal cord injury left him paralyzed from the chest down. After returning to Chattooga High School, he graduated with honors and senior medals in information technology and public speaking. With help from the Vocational Rehabilitation Program Services, John graduated from Berry College with a BS in government. As a student there, he received multiple state and national Model United Nations awards. He also won an individual novice national title in public speaking and contributed to a national team title as well. With VR's help, John is now a program analyst for the Centers for Disease Control, CDC. In this position, he works to maintain efficiency and streamline processes to save money and time. Additionally, he serves as a member of the planning section on the CDC Emergency Response Team, does motivational speaking to student and civic groups. John was also recently appointed by the governor to serve as a board member of the State Rehabilitation Council. John is the first person to tell you that without VR, I wouldn't be the person that I am today. With that, I'll open it up for questions.
Representative Henson.
Yes, ma'am. I think what they did is they came up with I think 1% was the factor that they used. But as I understand it, we are encouraged to not do an across the board, but to really look at a merit system to be used either in terms of paying for performance or for recruitment or retention. And so we have not actually gone through the time to develop a plan of how those will be administered. But I think the number that they used, or the factor, was 1%. That's correct. If we did an across the board, that's correct.
So what you're saying is some people might not get any increase and other people might get a $600.
That's correct. That's correct.
Is that really enough to attract additional people?
No. But it's also, at least it is some way to say appreciation for the hard work that they do every day. And it's not just the certified rehab counselors. We have housekeepers at Warm Springs who probably make, minimum wage or just above. So, we have to take that money and prudently and as good stewards distribute it in a way that we think is the best way to at least show some sense of appreciation and reward for the work they've done. You're welcome. Any other questions?
Are there any? I don't see any. Thank you so much.
My pleasure.
And
Thank you very
for
much.
the work you're doing.
Thank you.
Appreciate it very much. We will transition now into some public comment, and we have a good number. Let's see how many we have here. Let's see that one and see if it's anybody's added. I don't believe we've had any additions, so we have 11. So we'll just start and go from there. And let's see the time. We have about 35 minutes scheduled, but we'll see how that goes. Might take a little bit longer, I know, for some. Let's see. Let's start with Dawn Randolph. And if you do have any materials for us, that's great. Feel free to bring them up. I'll put it on Representative Howard down here that maybe he'll take them and help get back to us.
Madam Chairman, members of the committee, thank you for having us comment on today's budget. My focus is on Georgia Vocational Rehabilitation Services, specifically the Vocational Rehabilitation Program. By giving you some background, I'm Dawn Randolph, and I represent GATES, which is Georgia Association for Training, Employment, and Support for People with Disabilities. You will see some other folks come along and talk specifically from their programs. We have Goodwills and Bobby Dodd here today to speak with you specifically on the impact that GATES has across the state. We have 17 programs across the state within GATES. There is a strong economic impact. Matter of fact, studies have shown that people with disabilities, when they get into employment, that return on investment is about $1 to every 16. So $1 we invest brings $16 back to your community, which is very exciting when you think about all the areas of the state. When you put a person with a disability back to work, that means they're becoming a taxpayer instead of a tax user. And that also creates and fosters independence and wonderful things within their lives and in their families' lives. I go back many, many years. When I started in 1996 down here at the Capitol, I was representing folks with developmental disabilities. And I was even around in 99 when we moved VR from Department of Human Services to Department of Labor. So I've seen VR transition over almost 2 decades now. And I've seen the wonderful work with people with disabilities directly in the community and the impact that can be made. What we know is that folks with disabilities also have a lot to offer to their employer. And you're going to hear some stories from our Goodwills, Bobby Dodd, and you may have heard from your home folks about how they have found work for folks, but the businesses are the ones that benefit even more than the person with a disability. Because what they're finding is this person really appreciates and gets into their job. And they create an atmosphere of dedication and camaraderie among their workers. So it's really a win-win basis. When we've seen Voc Rehab move out from now Department of Labor and more intensely focus on folks with disabilities as an independent agency, I think that speaks well to just that little bit of extra help that needs someone to modify, whether it's an assistive technology device, to help them with mobility and access, and to make those relationships, which all of us know is very important when we're seeking an employment situation. You know, we all are looking at someone that helps us get in there and keeps us in there. If you have just a little bit of a higher barrier, then how do we sort of facilitate that? Supported employment and other types of facilities with employment, that's what makes a difference. There was also a study by Home Depot that looked about the satisfaction not just among their employees, but their customers. And they found that their customers were going into stores where a person with a disability was employed, was more loyal in that particular facility or that Home Depot place than other places. Those studies have been replicated around the country. So we're really excited that you all are taking a very hard look at how we can fully fund the Georgia Vocational Rehabilitation Services so that we get services in your communities at the full extent possible to serve all of those folks with disabilities. Again, I leave you with Georgia Association of Training, Employment, and Supports for People with Disabilities, GATES, is a statewide organization with 17 members, and they meet to really try to figure out the best practices, to collaborate, to share resources, to develop those business relationships, and make a difference for an individual with disability so that they can have full employment for as long as possible. And that's what we're asking, to fully fund an agency. We need $8.2 million this year or in the next preceding years that would draw down over $30 million, nearly $34 million in federal funds, which would fully fund VR and get us ready for those veterans that are going to be returning home very soon. We're talking about lots and lots of our veterans coming back to Georgia, wanting to be in Georgia. You probably heard that from our veterans folks yesterday. I'm an Army brat. My dad served his entire life, born in the military, retired from the military. And I know, because I work with vet families, how important it is that we get them back to work. And we have our wounded warriors that are coming back in droves with families that are in crisis. And so we need to make sure that we're ready for that when it comes. We've got the money sitting up there. It's our federal dollars. We need to draw down every dollar we can so we're ready to serve all of those folks. Any questions?
Oh, you do, Betty. Representative Harden.
What was the federal match?
The federal match is 1 to 4. So every dollar we put in, the feds give us 4 back. But it's not giving us 4 back. That's our money. That's been allocated from a formula that says Georgia has X number of citizens, almost 10 million. We have about 1.2 million folks that are with a disability, and about 650,000 of those are eligible to work. So that's that formula. And then, of course, we also have a very large retired and veteran population. So all of that put into some long formula that says we get that match. We have left that money on the table for many years, and even sadder than that, that's been reallocated to places like New York, Pennsylvania, West Virginia, when we really, those are our federal dollars.
Thank you.
Sure.
Thank you. Any other
Thank
questions?
you so much.
I don't see any. Thank you. Okay, next, Ron Scroggy. I don't see Ron. Dwayne Hathaway or Duane? I'm not sure. Great.
Madam Chairman, committee, thank you so much for allowing me to speak today. I'll just take a very brief time. My name is Dwayne Hathaway. I'm the Executive Director for Georgia CASA, Court Appointed Special Advocates. I'm not going to go through all of the handout, but I leave it with you to peruse at your will. The one thing I would like for you to look at is the map in there, and this is kind of the story for CASA. We're 25 years anniversary this year. We're serving 143 counties. We have 47 affiliate CASA programs throughout the state that recruit, train, and supervise court-appointed special advocate community volunteers that advocate for the best interests of children that have been abused and neglected in dependency court. And on behind all that, you'll see a roster of the locations where we have the affiliate programs, information about that. And what I'm really here for to talk to you about on behalf of this network, this 2,000 volunteers plus strong, another 700-800 staff plus board members. They're all nonprofits, or they're part of a nonprofit organization, or they have advisory boards because they work through the court system. On behalf of that network, we're asking for a $500,000 increase in our state funding that would be allocated back out, most of it back out to those programs. The history of our state funding has been that currently we're at $1.7 million. That represents 20 cents on the dollar of what's raised by the CASA network. So it's and so the last increase for the CASA network was in 2008. We've been very fortunate. We've not had any decreases since then. We've been able to maintain and sustain that current level of funding, and we're very appreciative of that. During that time, we have expanded. You can look at the map, but we've expanded into 26 new counties since 2008. We've done, we've used we've leveraged that funding to be able to continue to work and attract private funding so we can continue to do the work for abused and neglected children. This money, this increase would go to help build capacity of these 47 affiliate programs out there, to help them recruit more volunteers, and train more volunteers to serve more children. We're at about 60% of serving the children that are in care. It would also help us to expand. The target for next year would be 5 additional counties. And we only have 16 to go, and we're proud of that. But I would just say that the other thing that I want to speak on behalf of the CASA network is that we very wholeheartedly support the funding recommendations or the budget recommendations for DFACS and the governor's project for a 3-year increase in funding for them. We wholeheartedly support that we think that's very much needed. On the other hand, we feel like that CASA, the volunteer base, the involvement that we have statewide, and you can see some of the information on the left-hand side. It'll tell you, it'll give you some more in-depth information about the impact, the value that CASA brings and adds to the child welfare system in Georgia. This particular session at child welfare is part of the discussion. The governor has made it part of the discussion. We feel like we add value to the child welfare system. We feel that the child welfare system in Georgia is stronger because we have CASA throughout the state. So I would ask you today to help support us and increasing our funding requests. So thank you very much. Any questions?
I don't see any. Thank you so much, too, for the work that you are doing. Next, Cheryl Cornett.
Good afternoon, Madam Chairman and committee. Thank you so much for the opportunity to make comments. My name is Cheryl Cornett. I am Vice President with Goodwill of North Georgia, based here in Atlanta, but serving 45 North Georgia counties. We cover a lot of territory, and most people are familiar with Goodwill's as a social enterprise, which is a thrift store model. I am the Vice President of the mission side of our business. Our mission is we put people to work. Last year, my Goodwill put 11,706 people to work. 360 of those were with our own Goodwill massive network. We have about maybe 2,500 employees at this point within our Goodwill, but the balance of those 11,000 plus were placed with employers in the community. I'm here today to speak on behalf of vocational rehabilitation. I've been in this field for 30 years. I had a business economics degree and happened upon a temporary job some 30 years ago, helping people go to work. I must say that it is perhaps the best return on investment from an economic standpoint, and I'm here to advocate for some serious support for vocational rehabilitation. Now, 30 years ago, the model was a sheltered workshop program where people with disabilities were protected and nurtured and given experiences and adventures. But we said that we put people to work. And in the evolution over this 30-year period, it has been amazing and exciting when we moved away from a sheltered model and we thought we would have to beg for placements with our employers and businesses out in the community. And in fact, we found that businesses accepted, although they were a little bit concerned, to accept the graduates coming out of our training programs. What a change a couple of decades has made. Today, our employers find huge value in our graduates and seek out candidates for their job openings from community providers like our Goodwill. In FY12, our Goodwill alone served almost 2,000 people with disabilities for Voc Rehab. Of those, remember, we do vocational evaluation, job training, and employment. of those, we secured competitive employment for 655 at an average wage of $9.47. These people were going to work in Toccoa, in Rome, in Oakwood, up near Gainesville, Stockbridge, all over our 45 county area, average wage $9.47. The year we're in currently, we hope to serve almost 1,000 people. That is half of who we served 2 years ago. We hope to secure employment for 365 people, and we're trending ahead of that projection. The challenge is funding for vocational rehabilitation. When this agency exited from DOL and became an independent agency, we all celebrated and did the happy dance. But what we find is that there is a significant loss of funding for this agency. Some $20 million did not transition when VR became independent. It's having a huge impact on availability of services in our communities. So the impact of this is not only fewer people served, fewer citizens with disabilities going to work. My own Goodwill delivered services in 14 communities across our 45 counties. And we were growing. We were adding communities. Today, we deliver services in 7. So we have closed Rome, Cartersville, Tucker, Madison, West Athens, Northside Drive right here in North Metro. Those communities are feeling the loss of services. We're trying to live within VR's budget. So it's quite the challenge. The needs are pretty incredible. So because we are all about stories, I do have a story for you. I wish I had this young man here to meet you. His name is Adam, and he is now a permanent AutoZoner at the distribution center in Livonia, Georgia, up near Toccoa, served out of our Toccoa site. This young man was a temporary employee with AutoZone. Goodwill had forged, in partnership with Voc Rehab, a wonderful relationship with AutoZone, where they allowed our trainees to get work experience in the AutoZone work environment, competitive environment. This is our community-based model. And AutoZone would hopefully offer a job to that individual, if not a reference, as they went out and sought a job elsewhere. So our partnership was rocking along, and we were approached by their HR manager one day who said, I have a fella that I'd like you to talk to, and his name was Adam. He'd been on temporary status for some months. He was motivated. He was energetic. He loved AutoZone. He was making his supervisors and his coworkers berserk. He was ADHD with all the complications therein. He had personality issues. He had social issues. He had attention on task. He would wander. If you've ever been in a distribution center, they have forklifts running everywhere. He was a danger. And yet they couldn't quite terminate, and they couldn't make him permanent. They asked if we could help. So we reapproached VR, Voc Rehab, and said, we've watched this young man. We think that he would really benefit from the services available through the greater vocational rehab menu. VR put him on caseload, worked with him a bit, sent him back to Goodwill. We placed him in that AutoZone environment, and today he is a permanent employee. He is, as he says, every morning I get in the zone, and that's the AutoZone. He's now independent, has his own apartment, and is a valued and safe employee of AutoZone. I share that with you to say businesses and employers want citizens with disabilities. AutoZone keeps 2 slots vacant in their staffing just for our graduates, and we can't keep it filled. Employers want those citizens with disabilities. There is a place in our society, in the workplace, for all who are motivated, dependable, and reliable, regardless of their abilities or disabilities. That's it. Do you have questions for me?
I don't see any, but thank you so much for your
Thank you.
testimony and
My
for the
pleasure.
work you are doing.
Thank you so much.
And I believe we have someone else here from Goodwill, Kathy Carlisle.
Good afternoon. I'm Kathy Carlisle. I'm the Director of Mission Services for Goodwill Industries of the Southern Rivers, which is located in Columbus. We serve the other counties that she doesn't serve. We don't serve all of them. We do serve 50 counties in Georgia and a few in Alabama. We provide career services and training services to individuals with disabilities. In 2013, we actually served 34,000 people, and that includes our disabled, plus the ones coming through our career centers, and put a little over 4,000 or connected over 4,000 to work. But what I really want to talk to you about is our education and training centers and our services to individuals with disabilities. We provide skills certification training programs for individuals with disabilities. Within our training center, we have retail training, custodial training, call center training, and ServSafe training. We even have, with our ServSafe training, a partnership with McDonald's where they have given us a McDonald's restaurant that we have inside of our training center. And with some ARA funds, we purchased fake food that looks like hamburgers, and we can teach the individuals with disabilities how to feel and touch the food, communication, work ethic, all the things that they need to succeed. And then McDonald's in our partnership will allow these individuals to go and have community work adjustment training on site. And we've had an excellent partnership with them hiring our individuals with disabilities. We also have partnerships with schools where we work with seniors in high schools that have basically aged out. They have nowhere to go. They're slated for a life either in the criminal justice system or on the couch because they don't have skills. So what we do is we provide skills, we provide life work application, which is work ethics and work behaviors, and we get them ready to go to work. So we find this quite rewarding. In the last 3 years, we have really done a lot to increase and expand our programs, particularly in Noonan, Columbus, Albany, and Valdosta. As a matter of fact, in Columbus and Valdosta, we are the only training programs for individuals with disabilities. Goodwill has invested as a partner with VR money into our programs to add classrooms and facilities and employees so that we could provide even more services. And what's happened is over in 2011, we served 381, and these are just strictly VR. We'll tell you that we also serve veterans, and we serve WIA clients, fatherhood clients, so we're especially enjoy partnering with DHS with that, but just for our VR clients. And now we've seen that go down to 94 that we will be able to serve this year. I'll just tell you personally, 4 years ago, I was working at Columbus State University. I was the Dean of Enrollment Services and found myself looking for a new career after 14 years in the university. And I'd never really worked with people with disabilities before. And Goodwill granted me an opportunity to work with them. And I think the biggest surprise for me is that I thought as a citizen that individuals with disabilities, that they had all sorts of supports and services and programs, and why did they really need one more thing? And what I found is individuals with disabilities and our vets, when it comes to transition to work, the services are almost zero. So my plea to you today is along with the others, is just for you to consider anything that you can do to increase the funding to vocational rehab. They are a great partner for us. They provide an awesome service. And these funds would help us as providers to continue to provide services to the individuals that need it so much. I also have a story, just to give you an example. A couple of months ago, we had a referral from Voc Rehab. Her name was Martha, and she's visually impaired. And she was so excited to be in the training program. We have a call center in our training program in Columbus, and we have all of the assistive technology to help her. And she was going through what we call work eval, so that we could hopefully get her into the actual training program to receive a national certification from Help Desk Institute. And because of funding, she was pulled. And I don't get to be one-on-one so much with the clients, but when I saw her leave our facility, it just broke my heart. And she was devastated because she thought for the first time that she had hope, and it was gone. It's not the fault of VR. It's not the fault of Goodwill and the agencies trying to help. It is a situation, as always, funding. So I just ask you to please consider anything that you can do to increase funding to help individuals in Georgia to go to work. Thank you.
Thank you, and thank you so much for your commitment. I don't see any questions. So, Okay, Wayne McMillan.
Madam Chair, members, thanks for this opportunity to speak with you. I'm with Bobby Dot Institute. I'm the president and CEO there. We are an organization that is in the business of creating employment opportunities for people with disabilities. The people who have preceded me have really made a compelling reason for you to consider adding or recommending adding $8.2 million to VR. We're about changing lives. About 80% of the people's problems can be solved through employment. Now, you've heard the commissioner here talk about defects and children that are coming through foster care. Those children need jobs when they exit that system, or else they become a tax liability and burden. And what I'd like to speak to you tonight on is the business case for supporting VR and people with disabilities through employment. It was a great day that VR became its own agency, but one of the unintended consequences was there was a shortfall in revenue that they were not able to match through RSA. And you've heard that talked about today. That was about a $20 to $30 million loss in revenue. And for many organizations like Bobby Dot Institute and Goodwill, that meant we served fewer people. If you want to talk about job creators in this country, look at your nonprofits. Look at the folks working through VR, and you will find people who are going out and developing and creating jobs. We created 125 jobs for veterans for call centers that are being resourced back to the United States. Really good jobs for good people. We don't feel like people who stood on the front line should stand in the unemployment line, and that has been a godsend. We have recruited folks out of veterans out of shelters and helped them get their lives back on track. So the question that I would have for you and my state representative is, if there's 4-to-1 match in Washington, why are we not going after that? We will give tax concessions for someone to locate a plant in Georgia, and we will end up paying. But at the same time, when we have a system set up like the VAR match system, all we have to do is set that money forward and you get it back. So when we look at it, a 4-to-1 return sounds really good. I mean, I take that in a heartbeat. But if you had a 4-to-1 return and got $20 million more for services, I can tell you that would have a multiplier of at least 6%, because you're getting people off of entitlement programs, you're getting people working, they're paying taxes, and they're being consumer. This employment program is an economic growth and stimulus program, but what we tend to do is look at it as we're doling money out, not getting any return on it. And I would just submit to you that the wonderful stories are, there are great folks who have developmental disabilities to people who are veterans with PTSD and all that, and that feels really good. But from an economic standpoint, this is really a good stimulus, real stimulus package that brings work and benefits to all the Georgians. And what I would like to ask you, and ask you to consider this very seriously, is adding $8.2 million so that we can get a $33 million match in 2015. If you do that, you will put people to work and you'll help this economy along. I really hadn't planned on making this speech because everybody else who came before me took all of my good stuff. So that was rather from the hip. But are there any questions or anything I can help you with? Does it make sense to get $32 million for putting up 8?
Yeah, let me.
We're asking you to put it in. It's not in 2015. What happened was the state VR, when it was under DOL, had other money that they could match, and they were getting $90 million. I think they're getting $60 million at this point. That's a really big difference. Absolutely. And they didn't know that at the time. I mean, it was just an unintended consequence of that move. It's a real good opportunity, though. Yeah, it actually started last year in FY13, which started in July of 12. And our organization lost about $500,000 in VR funding. The total impact of $500,000 on us was a $2 million loss to the state of Georgia in terms of revenue, employment growth, and other benefits. So this one is to me, so straightforward a business proposition that I can't find any reason for someone not wanting to support this. Thank you so much.
Thank you so much. Next, Joe Newton. Sure. Why don't you just leave them right there and we'll send them back here to us. Is that okay?
My name is Joe Newton. I'm a retired law clerk for retired Supreme Court Justice George T. Smith. I work as a volunteer math tutor in middle school in Gwinnett County. I teach primarily immigrant children and low-income children. I want to make it perfectly clear that I have nothing against immigrants. In fact, I'm doing everything I can to educate their children. What I want to talk to you about today is some misconceptions in the refugee resettlement program. On this individual sheet, you'll see here that the post-employment follow-up for refugees in Georgia yielded 44% of the clients remained employed at the end of 30 days of 30-day follow-up, and 18% remained employed at the end of 1 year. Now, the reason 44% of them remain employed for 90 days is that the contractors that we hire with the federal pass-through funds don't get paid unless these people work 90 days. So they work real hard to keep these people employed for 90 days, and then after that they drop them and go back to the airport and get another group. You see, there's no money past that time, really, that the contractor can generate. Now, most of these contractors are charities and nonprofits, and I submit to you that there's no such thing as a nonprofit. Now, they use the definition of economic self-sufficiency to persuade the governor and legislators that these people are economically self-sufficient. And the definition they use from CFR 45-400.2 allows them to include virtually every welfare program they qualify for in determining economic self-sufficiency. So you can be almost have a 100% welfare package and still considered to be economically self-sufficient. They're advertising to you that 80% of their people are economically self-sufficient. I submit to you that that's misleading and that does not reflect the common ordinary understanding of what economic self-sufficiency is. These refugees are anything but economically self-sufficient. Now, these folks are coming from various countries around the world, and obviously they need help. If the people who run refugee resettlement were sincere about helping refugees, they'd be trying to help these people overseas. We're taking around $9 million in federal pass-through funds that basically are, as far as the refugees concerned, for the most part exhausted in 90 to 120 days. After that, the Georgia welfare agencies pick up the tab, and these folks become lifetime welfare beneficiaries. And you end up paying for this for the rest of their natural lives. And in a number of cases, this is generational, so you end up picking up the tab on their children too. I suggest to you that we have enough people in Georgia to help already. I estimate that the welfare bill for this is over $40 million a year. You have a document in there that shows the welfare costs down the right-hand corner. On that particular year, the total welfare costs, as far as it could be calculated by the Department of Human Services, was excess of $17 million a year. That figure has grown exponentially since then. That figure does not count secondary migration. It does not count the asylum program, which is estimated to be 3 or 4 times as large as this. You may not be familiar with the asylum program, but that's how President Obama intends to bring in 2 million Syrians into the country. I think you have another page here that's a snapshot of the school money. That is by no means inclusive. In fact, the program expands so rapidly that the state agencies can't keep up with the data they need to furnish you to determine what this actually costs. The sheet that shows the total refugees per county is this sheet, and that figure down in the bottom right-hand corner is in excess of $17 million. And that was in, I believe, 2010. Now, since then, bear in mind this program is as signed into law by President Carter in 1980, has brought in at least 66,000 refugees. And if you listen to the refugee resettlement advocates, that figure is probably close to 70,000 here in Georgia. I'm not claiming any more than 66,000, but I think they do. These sheets here shows the 2011 calculations per state. And in Georgia in 2011, 34% of the people they claimed to be working actually worked 90 days. They did a little better in 2012. It increased up to 41%, and now it's 44%. Every state north of Georgia on the East Coast, including South Carolina, has a higher employment rate than we do in Georgia. We can't even help our own people in Georgia. We have been a victim of an employment rate for the last few years that has been in excess of 8% in the metro Atlanta area. It's finally, I think, dropped a little lower than 8%. It's still in doubt as to whether that's going to remain that way or get better or worse. On the second page, you see the list of welfare programs that these people participate in. I marked in bold print with the stars at the top, Georgia Peach Care. Governor Deal is, to put it mildly, terribly interested in the effect this program is having on peach care. This is costing us an astronomical amount of money. I suggest to you that you had a whole list of people here and agencies here today that you need to help. These are your people. Now, we have been an incredibly generous state. We have funded this program for 33 years. This is our 34th year in the program. I think it's time to cut this off. As the public, this program has survived because it has remained, for the most part, anonymous. I have taken it upon myself to remove that cloak of anonymity, and through my organization, Refugee Resettlement Relief, I'm telling people in Georgia what's going on, and the reaction is visceral. And I suggest to you, you will be hearing from your constituents if you hadn't heard from them already. They are really not happy with this at all. It's time we help people in Georgia. Now, I haven't even gotten to the issue of schools. The refugee resettlement people claim that they're getting $12.4 million in assistance to the DeKalb County schools. I've talked to the school lobbyists around here. They're not familiar with any $12 million. I really don't know how they came up with that figure. But I do know this. I talked to the Gwinnett people, and we're not getting anything in the way of federal funding to educate refugees. Now, the target assistance grants require that the refugees live in DeKalb County, I believe, for about a year. What's really happening is the refugees stay there a few weeks or a few months, and then they move to Gwinnett. And then we have to absorb the cost all the way for the rest of their education and welfare benefits. This is spreading rapidly throughout Georgia. These people have overwhelmed Clarkston, Scottsdale, Avondale states. Prior to the refugee resettlement program, they overwhelmed Dorville, Chamblee. We're flooded with these people in southwest Gwinnett. Peachtree Corner is surrounded on three sides with these people. They're all the way out Roswell Road to the Alpharetta area, and we're just opening a brand new mosque in Marietta. This will come to your community, and I suggest to you, if you don't stop this, it will run you over like a train. Thank you.
I don't see any questions, but thank you for bringing this to our attention.
Thank you, ma'am.
Appreciate it very much. Emily Pelton.
Thank you, Madam Chairman. I'm Emily Pelton from Refugee Family Services, and I'm here to assure you we're not at all anonymous. And we're very pleased to be here today to address some of the points that were just raised by the previous speaker. I do have two colleagues with me today who are directors of resettlement agencies, and I would request that they could come join me at the podium so we could respond to questions as a group, if that's acceptable to you.
Certainly, certainly.
Okay, yes, and they're next on the list, so we'll try to be brief. So I am the executive director of Refugee Family Services, an organization that helps refugee women and children who have escaped war and persecution with job training, tutoring, and many other services. I'm also the chair of the Coalition of Refugee Service Agencies, 12 organizations that work together to resettle refugees, serve them, and help them successfully integrate into our community. I don't know if any of you had the opportunity to attend our event this morning. It was a wonderful legislative event. It was well attended, and we were very pleased to be here to be able to talk about some of the assets of refugees and what they bring to our community. So today we would like to, we're not actually here to request any changes to the budget or request any additional funds. We're really here for the sole purpose of clarifying some things about the state refugee resettlement program. And first and foremost, we just wish to emphasize that that program, which is in fact nested in the DHS budget, is entirely made up of federal pass-through funding. So that is not Georgia state taxpayer money, and we think that's an important thing to recognize that sometimes has been misrepresented in fora like this, unfortunately. Today we would like to talk about a few points that were just raised by Mr. Newton. In fact, earlier today had the opportunity to invite him to come and speak with some of the organizations doing this work, so we might have a direct dialogue with him about our budget and our operations and some of the work that we're doing. But particularly, I think the points we'd like to address have to do with the self-sufficiency rate of refugees and how successful they are in finding jobs, because in fact Georgia leads the nation in the self-sufficiency rate of new refugees, and we're in fact very proud of that. We'd like to talk about the number of refugees actually on TANF, which is a very small number. We'd also like to address the point about whether we are helping people overseas, because in fact that is a part of the mission of several of our organizations. And we'd also just like to address some of the suggestions that were raised about the number of refugees that may be coming from Syria and the impact on refugees on our schools. So there's a lot of content there. We've tried to address some of those things in the materials, and we will try to be brief. But before I introduce my colleagues, I just want to make a few overview kind of points. And the first is just that refugees are, in fact, a net asset to our state within 6 months of arrival. Refugees are very quickly working. They are paying local, state, and federal taxes. And we just did an analysis recently. In program year 2013, our organizations, the 12 organizations that work in this coalition, assisted 2,247 refugees to obtain jobs with an average hourly wage of $8.65 above minimum wage. This translates into about $1.7 million in sales taxes, $337,000 in property taxes, and about $750,000 to unemployment, not to mention over $6 million in FICA. So those are contributions to the state budget, and those are often not mentioned in conversations that focus on the drain that refugees pose to our economy, which we find unfortunate. So those are just a few facts and figures. We also just want to emphasize that the Refugee Resettlement Program is a federal program. It has, as Mr. Newton mentioned, been with us since 1980. And the decisions as to which refugees are brought here and how many is a federal choice. And the people who work in this industry, which I assure you is very much nonprofit, we are here to implement and help make sure that that goes smoothly, and that people who are brought here because they have been through war, rape, torture, and other kinds of persecution because of their beliefs and their political identity are brought here and welcomed here very much in the American tradition. That is what our organizations do. So with that, let me just introduce Padia Mixon, who is the Executive Director of Refugee Resettlement and Immigration Services of Atlanta, a local 501c3 that's been around for about 15 years, and she'll say a few more words about her organization, and also J.D. McCrary, who is the Executive Director of the International Rescue Committee in Atlanta.
Good evening. I just want to thank you for giving us the opportunity to speak this evening. I am the executive director of RESA. RESA is actually an affiliate of two national organizations, Church World Service and Episcopal Migration Ministries. Mentioning earlier, Church World Service actually does provide services to refugees in sub-Saharan Africa and also operates the Refugee Processing Center there. So we are a local nonprofit, but we are affiliated internationally. I just wanted to talk a little bit about some of the budgetary comments that Mr. Newton made earlier and clarify some things. First, the idea that we define self-sufficiency as a person who is on welfare. At RESA, our definition of self-sufficiency is a person who is paying their own expenses with wages earned. We do measure self-sufficiency for new arrivals. We look at people employed by the 120th day, and then we look at people employed by the 180th day. We also provide long-term employment services. We do employment follow-ups at 90 days and at 1 year, and that is a requirement of DHS that we do a 1-year follow-up. I have seen some of the state materials on the state employment program, and they do not match the reports that we have. Personally, we think there are flaws with the state database. We provide employment services two ways. To new arrivals, we provide employment services through a program called Match Grant that does not go through the state. The vast majority of refugees in Georgia are placed on Match Grant. It is an alternative to public assistance. It is a federal matching program. We have to match. It's a 1-to-2 match. So for every dollar that we get from the federal government, we have to provide 50 cents in private match. And through that program, we do have an 81% self-sufficiency rate by 180 days in Georgia, and that is one of the highest in the United States. The employment program on the state's website is federal pass-through money through DHS. That is a different employment program. I can say for my own reports, our 90-day self-sufficiency rate is 71%, so it's much higher than the rate that we heard earlier. I think other agencies have similarly high rates. We'd be happy to provide those reports. But we do define self-sufficiency as working. Most of the refugees that come into the state work. The number of refugees represent 0.001% of TANF cases in the state of Georgia. Very, very few of the refugees that we serve go on TANF. So we do view self-sufficiency as supporting yourself through work, and more importantly, refugees look at self-sufficiency that way. These are individuals. The average time in a refugee camp is 8 to 10 years. Most refugees have not been allowed to work when they're in the camps and are very anxious and excited about the opportunity of controlling their own fate through wages that they earn. It's a very hard-working population, very motivating to work with, and I would invite anyone to come and visit our Employment Services Department and speak to some of the refugees that we've served, because our staff works tremendously hard to find jobs that will sustain families. And with that, I'm going to pass this over to J.D. McCrary. He's Executive Director of International Rescue Committee. Thank you.
Thank you. Excuse me. I'll be brief. I know we're past our 5 o'clock time period, but thank you so much for listening to us this evening. It is very important to note that we do provide quite a bit of service to refugees overseas. One of the largest programs the International Rescue Committee has ever undertaken, my organization, is actually working with the Syrians that have fled the civil war going on right now. 100% of the services we provide to Syrians, and it's substantial, is overseas. There are no Syrians in the resettlement pipeline to come to the United States or to come to Georgia at this time. There are some advocating to the federal government to begin that process. But it may very well be this year or next year or the year after before any of the Syrians come in. And I cannot speak on behalf of President Obama, but I don't know about 2 million. The current number being tossed around about how many Syrians will come to the U.S. as a whole, not to Georgia, is only 12,000 is the number that I most recently heard. It's important to note that over the past 5 to 10 years, the ethnicities that have come into Georgia are Bhutanese, Burmese, Iraqis who have worked with the U.S. military during the Iraq War, and then East Africans. There is a lot of misinformation about who a refugee is and where they come from. For instance, there are no refugees coming from Chechnya, nor have there ever been. There's been some reference to the Boston bombers. They came in as asylees, which in and of itself is a noble status, and they are fleeing persecution just as much as many other folks. But our organizations primarily work with refugees and do not work with asylees. So it's important to note who we are actually seeing here in Georgia. And of the numbers that come to Georgia, we have averaged between 2,500 and 3,000 over the past 5 to 10 years as well. And that is a number that is proportionate to the 9.7, I believe, million people, million person population that Georgia is now. So we're talking about a tiny, tiny percentage of the overall population of the state. It's also important to note that refugees, more than any other type of immigrant coming to this country, go through the most stringent background check. That means you actually have, as we speak, thousands of people coming through Atlanta Hartsfield as we speak that have had little to no background checks. They're coming on tourist visas. They're coming on student visas. Refugees go through every single database that the federal government has before they are even allowed to interview to come here. So there is no question that they have been fully vetted, as well as going through several other background checks such as health checks and many others, including an interview to verify their claim of persecution for returning home. So thank you very much for your time. In closing, we have also generated quite a bit of support from multiple entities. One thing I want to make sure that to point out in your, I'm not sure if you have it in your packets or not, I can run this letter around. This is from the Georgia Poultry Federation, who has been for several years now enormous supporters of this program. And ask anybody who works with any of the poultry companies or Mr. Massey with the Poultry Association, and they will tell you what wonderful workers and employees refugees are. And I would venture to say that any chicken processing company in the greater metro area will tell you that they could not do what they do without the refugee employers that they hire. So thank you very much.
I don't see any questions. Thank y'all so much, and thank you for the information that you're leaving with.
Thank you for your time today. We appreciate it.
Vicki Johnson is next.
Madam Chair and committee members, thank you for continuing your hearing today. We appreciate this opportunity. I'm Vicki Johnson, and I serve as the legislative chair of the Georgia Council on Aging. And I'm here today to request a very small increase in the budget for the Georgia Council on Aging, which is an attached agency to Department of Human Services, and my request is for a $20,000 increase for the Georgia Council on Aging. And this can be, this budget can be found on the tracking form in section 27.21. This budget funds the operations of the council. The council is comprised of 2 staff members and 20 volunteer members who are appointed by state officials. These volunteers give of their time and their resources to serve on the council, and we have done a very good job of living with the budget cuts that we have had since 2009. We've taken several steps to reduce the cost of pulling our council members together for meetings, and so we feel that this $20,000 is an appropriate amount that will allow us to fulfill our obligation to you under law. But I'm also here today because the Georgia Council on Aging for the last year has been collaborating with other aging service advocates to identify the most pressing needs of Georgia's seniors. And the result of that investigation is that we're making a budget request for an additional $10 million this year for aging service budgets. And these budgets are contained within the Department of Human Service budgets. Rather than go into detail myself about that, I would ask that you allow me to bring Cindy Nelson to give you more information. Cindy Nelson serves as the Senior Citizens Advocacy Project representative. Can we do that? Thank you.
Was next on the list, so that's great. Thank y'all. And y'all actually are the closers.
The closers and keeping you from going home. So I'm Cindy Nelson. I work with several of the different senior citizens organizations. So let me just tell you a few of them that I'm representing here today, because it has been a year-long collaborative effort. So AARP, the Georgia Area Agencies on Aging, as well as the Alzheimer's Association, Georgia Gerontology Society, and of course the Georgia Council on Aging. So we have been working together so that we could come to you with one voice and say, what do the seniors of Georgia need? And I'm going to again make this brief. It's called Home and Community-Based Services. These services are really just very basic supplemental services that are provided to seniors that help them stay at home. And it's an economic thing that is going to be very beneficial for us as taxpayers if we can keep them home, but they also want to stay at home. So let me tell you what some of these services are so you can understand. It's home Meals on Wheels. And throughout the state, we try to provide hot meals once a day, 5 days a week. But because of budget cuts, those have been reduced, so most seniors now only receive them 4 days a week. I challenge you to go without a hot meal 3 days a week. I would not be able to live up to that. The other things that we do is provide meals at the senior centers and keep the senior centers open. But the meals at the senior center are part of the home and community-based services. Transportation to doctor's appointments or dialysis that they might need. That comes out of this as well. Respite care, so that their caregiver who's taking care of them at home can take care of something else they need to do, or adult daycare services. If I'm a caregiver and I have to go to a doctor appointment myself, I might need to take my mother to adult daycare services. So all of these things fall under the home and community-based services. These things are what keep people at home. Right now, we have 11,000 senior citizens in Georgia. I'm going to say that again because it seems unbelievable. 11,000 seniors that are waiting for some of these basic supplemental services. On average, it costs Georgia taxpayers $1,884 a year. So less than $2,000 a year to provide services to each of these people. Now, if these seniors didn't get the basic supplemental services, we all know there would be more falls, their health would deteriorate, and they are entitled to go to a skilled nursing facility. In Georgia today, the average cost of a skilled nursing facility is over $30,000 a year. Out of that $30,000, Georgia taxpayers pay $8,000. Federal taxpayers pay the rest. So I'm offering you to look at $1,884 a year to keep seniors at home, or we have to pay the $8,000 a year for skilled nursing facility. I'm going to tell you a couple more facts, because out of that 11,000 people, 82%, or about 9,000, already qualify to go to a skilled nursing facility and be paid by Medicaid. So if you think of, if those people don't receive the services at home, they're going to go to the skilled nursing facility. 82% of them do not need to have their health deteriorate any further than it is. They're hanging on by a thread because we offer these basic supplemental services. So we're asking for increased funding to reduce this wait list and to take care of these seniors. And these are our grandmothers, our grandfathers, moms, dads, aunts, uncles. These are our family that have taken care of us. We all know the silver tsunami is coming. I'm here to tell you it's here in Georgia today. It's just a matter of how big that wave is. I'd be honored to take any questions you might have. Yes. No, the money is not in the budget. I think that's why we're all testifying today. $10 million. I understand. Thank you, Representative.
Representative Howard.
Of the 10 million, what would be the cost savings? Has anyone done something, any analysis to see what would be the return on investment as it relates to seniors going into Medicaid, I think you said?
Right.
What's the offset there?
So I'm going to say that it's a cost avoidance rather than a cost savings. Okay. And to tell you the exact number, I haven't done the multiplication, but it's $6,000 by 9,000 people. So it sounds like that would be about $54 million to me off the top of my head.
And we're asking for that 6 million of the 10 go toward home and community-based services. That 6 million would reduce the waiting list by 3,000 people. And so that would be 3,000 people who would not require $8,000 a year for nursing home care.
Thank you for being more specific about that. Yes, our ask is for $10 million. $6 million is for home and community-based services. And then the other $4 million goes to more emergency placement. I know there's some funding that is in the governor's budget, but it's half of what we really need. And also $2 million for more adult protective services agents. As you heard earlier today, those are the foster care elders of the state of Georgia, and we just have a lot more. The caseloads are enormous. They aren't able to take care of the seniors. We need some additional help with the long-term care ombudsman. They have actually implemented a voluntary delivery program where they have a lot of volunteers helping, but they need to supplement the volunteers by paying their gas and mileage and train them. So they need some extra money. And then the final amount is for the senior legal hotline services. Again, we have volunteer lawyers throughout the metro area that take calls from all over the state just for seniors to provide them some quick legal remedies. And we know that they wouldn't have access to rural attorneys if they're homebound or live in a rural area.
And we would be happy to provide the budget detail on the breakdown of which budget lines the money would go to.
Yeah. I don't see any other questions
Thank
this time.
you
Thank you. And I want to
very
say
much.
thank y'all too, particularly for pulling together and finding ways to present that in a coordinated way. I've been to your meetings. I've seen how well you're working. And I do appreciate that much more so than separate asks. You've given us a great picture and something certainly to strive for.
We want to do what we can to make it easier for you.
Well, you are. So thank you.
If we could do anything else, let us know.
Thank you so much. Thank you. I don't see any further business to come before us, so we will adjourn and thank y'all. Thank you so much for the work that so many of you do in our state.